This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to show you how to use acupressure to treat your pet's arthritis at home. Acupressure is closely related to acupuncture, a traditional Chinese medicine treatment that has been used for thousands of years. The problem with acupuncture, it doesn't lend itself to the do-at-home approach. Acupressure, on the other hand, is something that every pet owner can safely perform at home. This is a diagram just showing some of the acupressure points. The cornerstone of traditional Chinese medicine is qi. Qi is a life force energy. It pulses through all life forms and is present in all of nature. According to TCM, it is the basis of everything that exists. Qi energy flows around pathways or meridians in the body. This links all parts of the body together, such as the organs, skin, muscles, and bones. The belief is that when a pet gets sick, the natural flow of energy is out of balance. You can correct energy imbalances by pressing certain points in the skin, called acupressure points. There are 361 acupressure points located along these meridians, although for our purposes, we're only concerned with a few. Before I start out showing you the acupressure points, I first want to show you how to correctly press these points. You can use your thumb, your forefinger, and I'll show one particular point here with Lewis. So I'm putting moderate pressure, enough to dent the skin, but not too hard to cause pain, and I'm holding that for 30 to 60 seconds. The BL60 and KI3 points. The BL60 and the KI3 point. The BL60 point is known as the aspirin point, and that's great for any type of pain or discomfort from arthritis in any area of your pet's body. So it's located here, just so we're into your pet's lower leg, and this area is called the hock. And right behind it is this big tendon called the Achilles tendon, or the gastroc. And there's a flap of skin right in between the gastroc tendon, you can see me touching it on Lewis here, between the gastroc tendon and the bone. And so that's the area, that's the BL60 point. So what you can do is put your thumb there, so you can just start doing it, twice a day for a week, seeing if it's helping your dog or cat if they've got arthritis. So I'm just putting my thumb right there, I'm putting moderate pressure, and I would hold that for 30 to 60 seconds twice a day. And then at the same time, I can hit the inside of that point, that's called the KI3 point. So I'm touching that here with my index finger. You can hold those two together in conjunction. The KI3 point in particular is a good one to affect all the organs. It's said to tonify the qi, so in particular it's helping all the meridians within your pet's bodies. The GV29 and GV30 points. The GV29 and the GV30 points. These 2 points are the most important points if we're dealing with a pet that has hip dysplasia or any type of hip arthritis or hip discomfort. They're located, so we're dealing with the back of your pet's body, their back leg. The big bone here is called the femur. In the very top of that femur, there's a point, a little bone that sticks up, also known as the point of the femur. And if you hold your dog's knee, you move it up and down, you actually feel this little point of the bone that sticks straight out, and it moves as you lift the bone up and down. That's the point of the femur. On either side of that, there's depressions in the tissue next to the bone. The depression in the front of that area is called the GV29 point. The depression behind that is called the GV30 point. So if we're dealing with a dog with hip dysplasia, these are 2 great points to know. And likewise, you use your thumb, your forefinger, and you can hold that for 30 to 60 seconds. Do that twice a day, and then assess within a week if that is helping. The GV4 and GV20 points. The GV4 and the GV20 points, these 2 points are especially important if we're dealing with a pet that has any type of back discomfort or back arthritis. They're fairly key points too if we're dealing with pets that also have sort of the ongoing discomfort as they age, whether it be from hip dysplasia or also whether it be from bones fusing on the spine, spondylosis. But they're 2 great points to know. One is called the GV4 point. And to find that point, I want you to palpate your pet's last rib. So here's Lewis's 13th rib. Draw a line straight up to the middle of his vertebrae, and there's a depression right there. It's between the 2nd and 3rd lumbar vertebrae. That point right there is called the GV4 point. So here, I'm just using my index finger and I'm holding that point, so that's called the GV4 point. So if we're dealing with any type of back discomfort, so that can be held for 30 to 60 seconds twice a day. And then the next point to know is called the GV20 point. So that point is exactly 5 vertebral spaces back. 1, 2, 4, 5. And it almost lines up. If you feel the back of your dog's leg, that's the front part of the muscles on top of the femur, draw a line straight up, and that'll hit that GV20 point. And you're going to feel the depression there. That's also in the area between L7, the last lumbar vertebrae, and where the first sacral vertebrae start, L7, S1. The ST36 point. The last point I want to show you is called the ST36 point. This is a key one if you're dealing with a dog that's got knee arthritis, typical with our pets that have had ACL strains, and they're dealing with compromised knees, had arthritic knees. So to locate that point, I want you to get to your pet's back leg, grabbing their hock, moving their knee up and down. So here I am, I've got my hand on Lewis's knee, and you move that joint up and down, you feel there's a depression, so that's the actual knee joint itself. And just below it, there's this ridge of bone. That's called the tibial crest. It's a ridge of bone on top of the tibia. And right next to that, there's a depression in that ridge of bone. Just go palpate your dog's knee now. So in the outside portion of the leg, and right next to that depression, on the lateral portion, the outside part of the leg, it's called the ST36 point. Thank you for watching this edition of Veterinary Secrets. What I want you to do right now is click that link in the box below, and I'll send you my free books and videos on how to treat your pets at home with my top natural remedies.